over 100 million Americans are walking around with fatty liver disease and they don't even know it. So what if you're one of those people with fatty liver not knowing about it? It's really important that we start paying attention to it. Now, if you're like most people, you probably don't think about your liver every day. I know I don't think about my liver every day. If you do think about your liver every day, maybe that's a different conversation we should have. But most of us don't. And it's really important because if one of us is one of the millions of Americans with fatty liver disease, it is really important that we pay attention to it. So today, that's what we're going to talk about. So if you know you have fatty liver disease, or know someone who has fatty liver disease, or you don't know, but you really want to find out if you do, this is the talk for you. So let's jump in. What is fatty liver? And how do I know if I have it? Well, before we start with what is fatty liver, let's talk about the liver. Let's talk about what it does. So it's important to figure it out. It is an organ that sits on the right side of your abdomen. It's about 3 pounds, depends on, your height and your sex, but it's about 3 pounds. And it has at least 500 known functions. Now, because I love you, I'm not going to list all 500s, but I'm going to tell you a few of the important functions so you could start understanding how critical it is that our liver stays healthy. So anything that you eat or consume, whether you drink it, alcohol, medicine, food, toxins, everything that you eat or consume is going to go through your liver. It's going to get filtered by your liver. It detoxifies it, which means it figures out which things are not supposed to be in there and takes the toxins out. But it also figures out which things are nutrients and stores them so we can use it when we need it. So it detoxifies and it manages our nutrients. It helps keep the amount of sugar in our blood level, and produces bile for digestion. It regulates amino acids, which are the building blocks of protein. It helps with blood clotting. So when we get cut, the fact that we heal has a lot to do with the liver. And it helps us resist infections. People sometimes don't know this, but it makes the immune factors that help us fight infections and also removes bacteria from the blood cells. So the liver is super important. And I think you're getting that now. And the liver cells are doing a lot of work. So we really need them to stay alive. But a fatty liver is when some of those cells, instead of being liver cells, are now fat cells. And if they're fat cells, they can't function as a liver cell. So the more fatty the liver is, the liver can't work. It's under functioning. It's underperforming. So now it can't detoxify well. It can't manage our sugar well. It can't handle our nutrients well. So it's a really big deal to have a fatty liver. And fatty liver happens slowly, just like gaining weight. It doesn't happen overnight. It slowly builds up. And so it's important to keep an eye on it. And your liver, remember I said, is about 3 pounds. So if you have 5 to 10% of it as fatty, that's a big deal because it's so small. So even 5 to 10% of it becomes a problem. Now we're going to talk about the symptoms and signs of fatty liver. This is kind of a tricky one because guess what? There's no symptoms of a fatty liver. It's silent in its early stages. So you could be walking around with a fatty liver and not know about it. Now, if it progresses and becomes a later stage disease, it does have symptoms such as excessive weight gain, bloating after eating, fatigue, malaise, nausea, vomiting, itchy skin, yellowing of the skin, swelling of the legs, abdominal pain or tenderness, dark urine, and pale stools. So late stage, those are some of the symptoms. But again, initially, you will feel nothing, which is why it makes it even trickier. So you might feel fine and walk around feeling great, but you might have a fatty liver. All right, you scared me. You're telling me I might have a fatty liver. You're telling me it's really bad for me. How do I test for it? All right, if you think it gets easier, it doesn't. This is tricky also. So, of course, you're going to go for your annuals because you're going to take care of yourself, and they're going to run a blood test. If the liver enzymes are elevated, it might be a sign that you have fatty liver. But you can have a fatty liver and your liver enzymes might be fine, which is, again, why it's so tricky to diagnose. The only way to really diagnose a fatty liver is with an ultrasound or a CAT scan. So if you have elevated liver enzymes, your medical provider, your doctor, NP or PA, because you know I love them all, will order an ultrasound to see if your liver is fatty. But if your liver enzymes are fine and you think you might be a candidate for fatty liver, and I'm going to explain to you what a candidate looks like, you can go ahead and ask your medical provider to maybe get you an ultrasound so you can see if you have a fatty liver. So testing is tricky. Symptoms are tricky. So if all this is tricky and I don't even know if I have it, let's at least find out how I got it. So that one's easy. Let's talk about that. There's two kinds of fatty liver. The first kind is called alcoholic liver disease. And that's the one many of us are familiar with. It results from heavy drinking. And so if you're saying, okay, I'm not a heavy drinker, I clearly don't have liver disease, I'm moving on to the next topic, I'll see you next week, E. Hang tight a second. I am not talking about alcoholic liver disease. So even if you're not a heavy drinker, I need you to stay here. Because what we're talking about is non-alcoholic fatty liver disease. The acronym is NAFLD because in medicine, we love acronyms. So this is precisely for people who are not heavy drinkers. And this is the type of fatty liver that I want to focus on today because it could be any one of us that have it. So how do you get a fatty liver? It's not from eating fats. You might think fatty liver, I eat fats, that's how I get a fatty liver. That's not the case. The way you get a fatty liver is actually from eating carbs and sugar. Let me explain to you what I mean. There is this horrible food out there called foie gras, and maybe I'm pronouncing it wrong, but it's basically the fatty liver of a duck or a goose. I'm going to tell you how they get this food, but for those of you, you might want to go like this because my wife refused to hear this paragraph. So the way they get this food is they take the goose or the duck, and they force feed it, not fats, carbs and sugar until the liver gets so fatty, and then they slaughter it, and then they serve it to people, but then they call it a fancy name called foie gras, and people eat it as a delicacy. It's a horrible practice, but the point is, when they want to create a fatty liver, they force feed these birds carbs and sugar. So it's the same thing for humans. If humans eat large volumes of carbs and sugar, their liver, your liver, will get fatty. Now, lucky for us, no one's trying to eat our liver so far, as much as I know, but it's the same concept. If you're gorging on sugar and starch, you're essentially doing the same thing to your own liver. Your liver is actually converting from liver cells to fat cells, and that's going to be a big deal. The reason this happens is because sugar, especially fructose, high fructose corn syrup, for those of you who heard of it, HFCS, another acronym, which is the root of all evil in the nutritional world, fructose actually ramps up something called lipogenesis. And I'm pretty sure I put this here because these are two big words. Lipogenesis. Lipo means fat. Genesis means creation. So if you're eating fructose, like what you find in sodas and candies, your liver actually thinks, oh, okay, this is my signal to create more fat. So the more fructose you eat, the more lipogenesis happens, the more fat is actually created. Other causes of fatty liver include excess alcohol intake, being overweight or obese or inactive, and of course, there's also a family history. I do want to say this. Unfortunately, this is not just an adult issue. Fatty liver is found in our pediatrics as well. Our children who are drinking the sugar and the smoothies and the frappuccinos and the candy that's full of fructose, we now are seeing young patients with fatty liver from years of soda and junk. So pay attention to your kids also. Okay, so who cares? Why is it so bad? I don't have symptoms. You can't see it on a test. Who cares? Well, first, for the reasons I told you above, right? I told you what the liver does and now what it can't do if it's fatty. But there's a little bit more that should scare you in case you weren't scared. Like, I don't care if I don't detoxify. I don't care if my sugar is fine, not fine. That's fine. Let me scare you a little bit more. So fatty liver actually causes inflammation, which triggers insulin resistance and prediabetes and diabetes. Fatty liver will also deposit fat in other organs of your body called visceral fat. Visceral is a fancy word for organ. So now you don't just have fat on your liver, you'll have fat surrounding your organs. And guess what? They won't be able to function well either. So this visceral fat is actually putting us at a higher risk for heart attack, stroke, diabetes, and other fun stuff. And it gets worse. As you have a fatty liver, your good cholesterol goes down, the HDL goes down, and the LDL, the bad stuff, goes up. Again, higher risk for heart attack and stroke. Now, this thing that I'm about to tell you blew me away when I learned it. Fatty liver will mess with your ability to control your appetite. Fatty liver will mess with your ability to control your appetite. And I'm going to tell you why. In order to feel full, we have to experience something called leptin. When our body sees a leptin, it says, okay, time, I'm full, appetite is curbed, time to stop eating. When you have fatty liver, it becomes leptin resistant, means it is resistant to the thing that tells you to stop eating. So now you're stuck in a loop. You have a fatty liver, and because you're leptin resistant, you keep eating, and because you keep eating, you can have more of a fatty liver. So it is a rinse repeat cycle. Once you have fatty liver, it makes it even harder to stop eating. So pretty scary stuff. All right, hopefully I scared you enough. Hopefully you're wondering if you have fatty liver. Hopefully your next question is, okay, got it. How do I fix it? Well, the good news is if you're at the beginning stages of fatty liver, this is reversible. If you catch it early enough, you can treat it. We're going to talk about it. If you ignore the signs or wait too long to seek treatment, of course, you might need medication or surgery depending on what happens. So let's go. Let's start talking about treating. You know what I'm going to say. You have to stop the junk. This fructose, this high fructose corn syrup, the sugar, the carbs, it is literally fattening up your liver. Don't know how to say that in a way without stuttering. It's literally fattening up your liver if you're eating this junk food. The processed flour, the starch, it is just making your liver fatty. Get rid of the high fructose corn syrup. They'll increase your sugar levels and it's going to make a mess. Now, it's not enough just to remove. You also have to put into the system detoxifying, liver repairing foods, such as cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, leafy vegetables like kale, collard greens, cabbage, arugula, and watercress. This helps produce something called glutathione. I think I mentioned glutathione just about every one of my lives, which really helps heal the liver. So we remove the bad, we got to put in the good. You have to improve your metabolism with exercise. You have to move around. I need you to take a break from alcohol. I'm not saying you'll never be able to have alcohol again, but if you're trying to repair your fatty liver, you're going to have to remove it temporarily. And once your liver is fine again, you will be able to reintroduce it in moderation. So it's not a forever thing, but it's definitely a now thing. We have to get your liver healed if you have a fatty liver. I need you to also eat protein. Now, when I say eat protein, please don't go buy protein shakes. Don't eat protein all day long. That's not what I mean. That's actually going to harm your liver. Your liver will not be able to handle all that protein. I mean that every meal should have protein in it. Should have a nice balance of protein to carbs. It is really important to have protein in your meal. It balances your sugar, it cuts down cravings, and it gives your liver the materials it needs to help itself. So we need protein in the diet. The other thing that we need, which kind of doesn't make sense if you think about it, is fats. Fatty liver. Why do I need fat? You need good fats. Good fats. Coconut oil, avocado oil, omega-3, good fats. Now, fats have to be eaten by themselves. You can't have fat on top of a carb and call it a good fat. So what I mean by that, just like I say, when I say vodka doesn't count as hydration, so let me tell you, taking your Italian bread and dipping it in olive oil, don't tell me that that's a good fat when you point to the olive oil. That doesn't count. Olive oil has to be eaten separately or over a vegetable or in a salad. Dipping your bread in the olive oil doesn't count as a good fat. Okay, so fats separate from carbs by themselves are really important for a fatty liver. When you eat fats, it doesn't trigger your pancreas to release insulin, so it doesn't stress out your liver. And when you eat the right fats, increases your metabolism, and decreases hunger. So fats have to be in your life. And of course, everyone talks about supplements for liver. And there's some really great supplements out there for liver, such as NAC, glutathione, milk thistle, methylated B vitamins, all awesome for your liver. But I do want to caution you, do not use supplements if you're not changing your diet. If you're out there eating everything I just talked about, eating your high fructose corn syrup, eating candy, eating carbs, dipping your bread in the olive oil, not making any changes, drinking alcohol, and you're going to add supplements to it, not only are you not going to help your liver, but you're going to overtax your liver. Okay, supplements, I always say, is part of this complete breakfast. It's part of an overall healthy lifestyle. It's not instead of. So don't take these supplements if you're not going to do the rest of the work. Okay, as we talked about fatty liver, as promised, we talked about what it is, how we get it. I think you know how to get it now, carbs and sugar, how to test for it. Pretty tricky to test for it. You could try blood work, but you're going to need an image. Symptoms, generally speaking, there's no symptoms. And now you know the fatty liver is a big deal. It's going to ruin your immune system. It's going to ruin your sugar system. It might affect your blood clotting ability, keeps you at high risk for heart attack, stroke, and inflammation. But the good news is that if it's caught early enough, you can reverse it by changing your diet. As always, I hope that this live provided you with some insight and help you understand what fatty liver is. But if this gets confusing, and sometimes it does because there's so much information and you want to work with us, you can reach out to us at thenewmethod.com. Because at the end of the day, we want to help you become the game changer in your life because, say it with me, you always knew there was a better way. I will see you all next week.